You are listening to Radio Maria Canada. We now present the Health Hub, hosted by Kathy Biasi.
Welcome to the Health Hub on Radio Maria Canada, exploring cutting-edge health and wellness information and therapies, helping you to take your health to the next level. I'm your host, Kathy Biasi, and I'm an holistic nutritionist and a professional cancer coach. In my almost 10 years within the integrative health space, and just a couple of years less than that as a talk show host, trumpeting integrative health, its evolution is exampled today with my guest, Dr. Celia Corbo. Dr. Corbo is both a chiropractor and a functional health practitioner whose mission is to empower individuals to unlock their best quality of life through prioritizing the health of their brain and nervous system. Her dedication in helping others stems from her own journey through health challenges and triumphs. Having overcome her own obstacles, she now helps guide others along their path to wellness. During her academic career, Dr. Celia discovered a fascination with the nervous system, guiding her towards a profound understanding of its functions and complexities. This fascination ultimately led her to chiropractic, where she discovered her calling to positively impact nervous system function through spinal adjustments. Driven by a desire to expand her knowledge in holistic health, she delved into understanding biochemistry, nutrition, and functional medicine. Leveraging both academic expertise and personal experience, Dr. Celia also specializes in functional healing through personalized supplement and nutrition protocols tailored to individual genetics and needs. With a wealth of academic knowledge and personal experience, Dr. Celia is driven by a mission to extend healing globally, empowering others to achieve optimal brain and nervous system function and health. Central to her approach are the three pillars of health: physical, chemical, and emotional well-being, each essential for holistic healing and activating your best quality of life. As you will hear, Dr. Celia is a great speaker, bursting with knowledge and enthusiasm. We talk about many things spiral off of some key points that I'll mention here. We talk about how the brain functions and how disturbances in these functions can lead to impaired living, how chiropractic affects the brain, and why Dr. Corbo has chosen to integrate her chiropractic practice with functional medicine modalities. You will really enjoy this show. You will enjoy Dr. Corbo. As mentioned, she's a terrific guest, a terrific speaker. Do stay tuned. We will be back in just a few minutes to speak with Dr. Celia Corbo.
You are listening to Radio Maria Canada. We now continue with the program, The Health Hub, hosted by Kathy Biasi.
Welcome back to the Health Hub. Our show has been recorded, so no opportunity for calling in. Please do follow us on our social sites. We are on Instagram, Twitter, and Facebook, and we are at the Health Hub RMC on all of those locations. Dr. Corbo, welcome to the show. Such a pleasure having you here.
Thanks so much, Kathy. It's really nice being here.
And as a fellow podcaster, YouTuber, how does it feel to launch your own podcast right now?
I am loving it, to be honest. It was something that I had manifested to start in like February, around the beginning of the year. But I just had a lot of limiting beliefs around it. And then I finally got around to doing it and getting all of the tech equipment. And I don't know why I haven't done it sooner. It's so much fun.
It is. And, before we get into our show together, I have just found that in my own practice, having guests on a show and talking to them I can't even begin to give you the impact it's had on how I practice and how I look at things. So bringing this information to everybody is a wonderful thing that you're doing, along with all of the other stuff that we're going to get into now. So you're a chiropractor. How long have you been doing this for?
I'm going to be approaching 4 years in December.
4 years. And in your intro, it talks about the health journey that kind of led you to this path. Was it a musculoskeletal thing that had happened to you that led you down this way, or something completely different?
It's everything, I would say, which is a little bit extreme, but it really started off with a lot of GI or digestive issues. Ever since I was born, I was very colicky and very sensitive to foods. And my journey really started with nutrition. And I was always trying new diets and new ways of eating because I was trying to figure out how to enhance my digestion and not be so sensitive. And that's when I really fell in love with health and nutrition, and then decided to study kinesiology at York University, where I fell in love with the nervous system. And after my undergrad, I didn't know what I wanted to do, but my mother was all about, check out chiropractic, check it out. It seems really cool. So I did, and it really ticked all of the boxes with understanding the nervous system and how we can optimize it, as well as improve the body through the biomechanical advantage with the spinal adjustments. So I went along to do that. And then over the course of my years, I've also suffered from many physical type injuries, like pulled muscles. I actually have a disc herniation in my neck, which is the most recent, I would say. So I do have a lot of biomechanical injuries, physiological injuries, but nothing I've never been able to overcome and then help my clients and my patients overcome in their health journey as well.
Well, when you say, we're going to get into the functional part, because this is what's really intriguing about your practice. When you say it ticks all the boxes, you've gone to school for this, but in my mind, the importance of the nervous system, the brain stem in overall health, I think is just starting to be appreciated. From personal experience, I know that the nervous system, if there's a glitch in it, if there's a fascial limitation, things like that, it can impact all of those areas that you're interested, digestion, so many different things. Why did you have did you know before you got into chiropractic work that it did check off all these boxes, heart health, digestion, everything?
Honestly, no, I never saw a chiropractor growing up with spinal adjustments as the modality used. I saw them for ultrasound for my mid-back, but then that didn't really work. So then I stopped going. So I never really knew what chiropractic was. And upon reading the description that we impact the nervous system through spinal adjustments, that's what really lured me in. Because when I was in my undergraduate program for kinesiology, I took all of the neuroscience courses, just really having such a deep passion and love for it. And then once I read that about chiropractic, I was like, oh, wow, I don't have to sit behind a desk and just look through microscopes in order to impact the nervous system or become a neurosurgeon. So I thought that was really cool that there was something else out there that I could still be passionate about through helping the nervous system, but it didn't have to be so medical and so research based.
Mm-hmm. I've had a chiropractor on, it's got to be a year or two ago, and his novel piece of practice within the field was working with infants.
Yes.
And that was very new to me. I've had 4 kids. I would have thought going to a chiropractor for an infant would be, I don't know, I just wouldn't have done it. But, he was the first one that really opened up my eyes to your profession. And he said, for people that have headaches, for their jaw alignment, but for children who have colic, who have that going to a chiropractor can just change the behavior and the health of a little one. So, it is something that I really want you to be able to expound upon here and to teach us about. Maybe we should pull back and go into Biology 101, how the brain functions, what the left side is, what the right side is, so that you can, once you start talking about what you're doing, we can say, okay, now I know.
Yeah. Absolutely. Let's dive into it. So in my practice, in particular, I don't necessarily specialize with pediatrics or with infants, but it is super important to understand the development of the human so you can understand how to better treat them. So although I'm not putting my hands on babies or little children, understanding that development is crucial and understanding dis-ease in the body as well as health. So starting back to the very beginning and talking about brain health, when we are born, we have two hemispheres of the brain, the right side and the left side. However, it's the right side of the brain that starts developing first up until the age of 2, which is when the left side starts to develop. But let's just talk about the right side for a second before we dive into the left. With that right side of the brain, this is what's really enhancing development as we go from infantry to toddlers or the 2-year-old stage, where we're very visual. So if you were ever to be engaged with a baby, you would never read them a Harry Potter novel, but you would show them a book with a lot of pictures and sounds and tactile type of things, because that is really what they understand, because that's the right brain. The right brain is all about the big picture. And that is a perfect example of it. It's looking at the visuals, it's feeling, it's touching, it's smelling, it's the 5 senses. Then at the age of 2, we have the introduction and the start of development of the left brain. Now, this isn't the big picture. This is the nitty-gritty details. This is the logic and the analytics. So this is why it's called the terrible twos, because once a toddler is going into that state of life, they start to get very inquisitive. They start to ask so many questions, and they're also trying to reason and understand how things work in the world, but they also can be very temperamental about it, because now the right side of the brain is starting to talk to the left side of the brain. And as they continue to develop, and as these two hemispheres continue to develop, we start to see that the left gets a little bit more of a nurturing than the right as the child enters into the school system. Because school is very much about learning facts, sitting at your desk, learning, memorizing, and really understanding all of the nitty-gritty details of things. Needless to say, there is still some kind of right hemisphere work, but it's not as strong as the left. And then as we continue to age, that left hemisphere is continuing to enhance, and I usually say it's turning up the volume. And that's why so many adults these days are really under a lot of chronic stress, or there are a lot of dis-eases going on in the body, because the left hemisphere was never the hemisphere that was supposed to be the main controller of the body. It was the right hemisphere. But through lifestyle choices that we don't necessarily adopt that are healthy, or through being too analytical or too stressed out, the volume of the right hemisphere goes down and the volume of the left hemisphere goes up. And that's why we see a lot of dis-ease in our society among our population.
So to get into better health, we need to nurture the right side of the brain?
You got it.
I have never ever heard this. Okay.
Yes.
So then
Yes.
is it a matter of going and getting an adjustment that helps the right side of the brain?
Yeah. So in my practice, I have 3 pillars of health that I focus on, because when you are trying to heal or when you are trying to be healthy, it's not just about getting chiropractic adjustments. It's not just about exercise or just about sleeping better. It's really multifaceted. So it's about the physical body, it's about the chemical, and it's also about the emotional. And the way that I like to educate my patients about this is to imagine a triangle with physical as your foundation, chemical being in the middle, and then emotional being that peak or that top place that we're all trying to achieve. Now, when it comes to nurturing the right side of the brain, physically, exercise is amazing, because in our prefrontal cortex, which is the very front area of the brain, we actually have a region just for motor movement. And a lot of the times, well, most of us are right-handed. The way that the brain works is in a cross pattern. So the left side of the brain controls the right body, and the right side of the brain controls the left body. And since the majority of us are right-handed, we're getting a lot of left-sided nurturing already. So physical activity is wonderful to do, but then also spending a little bit more time doing left side body exercise to nurture the right side of the brain. When it comes to chemical, We actually see this through stomach acid production, as well as other physiological processes in the body, but mainly stomach acid, where if you have a lot of acid reflux or you're not able to digest your food very well, it means that the right side of the brain isn't so active. So having your digestive enzymes, eating foods that are high in citrus, that will all help promote more acidity, which can help the right brain also in its enhancement and turning up the volume. And then finally, emotional health. And this is probably the hardest realm to really get good at because we're constantly changing, but really being mindful, being in the present, not letting those stressors really affect you, bring you into depression by reminiscing on the past, or bring you into anxiety states by focusing too much on the future. All about being present and just understanding that these are just moments in time and how you can emotionally regulate the body and help the right side of the brain.
Does it make sense to say that if our nervous system, which includes the spinal cord, the brain, if that is functioning well, that's our highway of information, correct?
Yeah.
I mean, that's information. And again, when we're trying to do an integrative approach, I feel that it's like above the shoulders and below the shoulders still a lot of the time. But that network is the go system for the body. And
Absolutely.
do you find that people haven't kind of associated the two things, like how that pathway works influences how your muscles work, influences all aspects of your health, cardiology, heart health, digestion, muscular work, all of that stuff. So when you're talking to people and you're telling them this, are you opening up windows that they had never even seen before?
Yeah, absolutely. And a lot of the times in my practice, whether it be through chiropractic care or functional health, a lot of people are very much trained to think that, oh, my chest hurts. It must be just that region of the body. Or, oh, I have diabetes. It must just be my insulin. So very much in allopathic medicine, everything is very segmented within the body. We have 11 systems in total, and we have a specialist for every one of those systems to go and see. And I think that is somewhat of a fault in our healthcare system because you're not looking at the body as a whole. You're not looking as a body of this network of systems that work together, but ultimately are governed by the brain and by the nervous system. And that's why chiropractic adjustments are so amazing because yes, there is that biomechanical approach to it where we're trying to relieve the body of back pain or neck pain or headaches or again, very segmental type of issues. Yet really what we're trying to do at the end of the day is just turn your brain on and keep that highway of health open so we don't end up in a state of dis-ease.
Can chiropractic work and adjustments impact fascia health?
Yes, absolutely. So everything is controlled by the nervous system, including the fascia. So if your fascia is not moving properly or there is an issue with the fascia, then there's probably an issue with the nervous system. And it's not sometimes as easy as just going for one chiropractic adjustment or just doing one thing. It sometimes has to be a combination of things, like things that we already know how to do, going to get adjustments, moving the body through physical exercise, eating healthy, better sleep, social connections, things like that.
Another area that I just want to touch on before we, get to the end of the first half, another key piece to brain function, nervous system function is receptors.
Yes.
And how they impact the body. And you might even, 5-10 years ago, it was discovered that, pathways can be changed in the brain. Does this have to do with receptors and how they can be enhanced and healthed up through what we do?
Absolutely. So when it comes to the brain, it was discovered I don't want to say pretty recently, but within the 1900s that the brain is plastic. So the brain can change its neural connections, and that's something called neuroplasticity. So our brain and our nervous system isn't rigid and it's not stuck this way. You have the ability to change. And the way that we can change it is through receptors. And what receptors are is basically, imagine a cell phone tower signal. It's just receiving signals from the outside world and bringing it into the internal environment. And then our brain processes it and then acts accordingly. And our receptors are our five senses. So whenever you smell, see, touch, or taste or hear anything, that's a receptor that gets processed through the brain. And you can start to have neuroplastic changes based off of whatever signal is coming into the environment. Including for chiropractic adjustments, you have receptors within the joints. And by keeping a joint stuck, you're affecting that receptor's ability to send a signal to the brain. So that's why a chiropractic adjustment is really powerful. Although it doesn't take very long, you're opening up that receptor, you're allowing for more mobility, and that improves the connection between the brain and the body.
Well, the whole idea of neuroplasticity, again, linking the body in total, if we have neuroplasticity, this directly implies that we have the ability to change body composition, to change muscle strength, and the muscle and the strength and longevity, this is like, it's front and center now in health. But the brain is a key part, and the neural system is a key part to muscular development, isn't it?
Absolutely, yes. And that's why when it comes to compensation, it's a lot of the time patients come in and they're saying, oh, this malady happened out of nowhere. I woke up one day and my low back, it just won't stop hurting. That's not the case. This has been going on for a very long time. Your body has just been masking the symptoms so it doesn't affect you day to day. However, it's reached that point where there's been enough neuroplasticity in an unfavorable way where now the muscle is not getting activated in the way that it's supposed to and the way that it's designed to. And now we have a problem where you need to go seek out care through a professional or through someone who's licensed.
Is chiropractic work sort of the first entrance into repair, or can you do it all?
I would say yes, in my own personal opinion. The analogy I usually give is of a car. You can't start moving a car if a piece is missing or if your tires are deflated, if the alignment is off. So usually what I recommend to my patients is that chiropractic is that first step to get everything realigned, to open up that communication between the brain and the body. And then once that's been established over a period of time, which is very different for so many people depending on what they're presenting with, then I usually recommend, okay, let's go see a physiotherapist. Let's start getting the body to move through active exercise and through rehabilitative exercises so you can start to have more functionality and more activity that you can handle.
Has the evolution of adjustments, or has there been an evolution of adjustments from, I saw a chiropractor many years ago, and it felt like he wanted to spin my head and he stepped on my back. And with the noise that it made, it was something. Is that still the way you perform your adjustments?
There are so many different types of adjustments. The way that I adjust my patients is through a technique called diversified. So yes, we are getting that high velocity, low amplitude thrust, which does produce what we call a cavitation, which is that popping noise. But definitely there's other techniques such as network, for example, where you simply just touch the patient very lightly, and then we have that flow through the nervous system and we can release a lot of maladies that way. So there's a lot of different techniques. I think that is really the art of the profession. And depending on who you go to, they will vary in their technique. But it definitely has adapted and evolved since the very beginning. There's a lot more research to understand what's actually going on in a chiropractic adjustment, as opposed to just chasing a cracking noise and then getting the patient to feel better.
Okay, wonderful. Let's take a break here. When we come back, I want to open up your practice to all of the functional approaches that you're taking, because I think it's an ingenious way to help your patients. So everybody, we will be back in just a few minutes to continue our conversation with Dr. Corbo.
You are listening to The Health Hub here on Radio Maria Canada, a Catholic voice wherever you are. To contact us and be a part of the show, email thh@radiomaria.ca. We now continue with the program. Here once again is your host, Kathy Biasi.
Welcome back to the Health Hub, everybody. We are discussing functional chiropractic work with Dr. Celia Corbo, who I just found out I knew as a little one, but that's a whole other topic. So Dr. Corbo, you have the integrative approach to chiropractic work, which, I am seeing more and more the medical profession. They are starting to take on a little bit of this, but this integrative approach that you have, I think is necessary. And I think it's a brilliant step for you. So can you tell us how you've incorporated the functional piece into your chiropractic work and the impact that you have seen with your patients?
Yeah, absolutely. Just a little bit of a preface before I dive into that. As a patient, I was always looking for a practitioner that kind of did everything. I know it's impossible to find someone, but I always found that segmented approach was what I kept getting into with our medical system. So as a practitioner myself, I thought, you know what, I can't do every single thing, but I can try and do most to help people. And that's why I segued into functional health as well as doing chiropractic. Because what I was realizing was when I was doing my adjustments on my patients, people were getting better, no doubt, but there was definitely this plateau moment. And they're always asking, what more can I do? What more can I do? And at this point in the treatment plan, they're eating healthier. They're starting to understand how to move their body more. They're starting to adopt those healthy lifestyle habits. But some patients just wanted more. And so I dove into different courses to get certified. And I finally found one through the Integrative Health Academy, where we really looked at the biochemistry of the body, but not just from a what to eat and how to move perspective. It really was all about understanding the genetics and what our genetics say about what kind of foods we should be eating and what kind of supplements we should be taking, as well as the nutrition, metabolism, blood work, and how to look at it more thoroughly, and then hormone health and gut health. And I found that when I brought this into my practice, even if a patient didn't want to do the entire protocol, just having that information in a deeper level of knowledge to provide to them, I was starting to see a lot more transformations beyond just the physical realm of the chiropractic adjustments and the regular lifestyle habits that people adopt.
So when you get into the hormones in the gut, we're going to see differences between men and women. Has your practice geared towards, one of the sexes, or do you treat men and women, just treating them differently?
Yeah, I treat both men and women. My niche, you could call it, is really high-performing female entrepreneurs, because I myself as one have really taken a hit in my own health journey since joining the workforce and trying to pay bills and rent and all the things. And it's hard to then keep up on top of your health because you're so tired or you feel so fatigued. So my clientele is mainly women who are entrepreneurs or who are just high performing. So even like moms who are just running around all the time with their kids, like that would be my ideal client. But I have studied about the differences between the brains of men and women. And it's a really shocking difference. When I was learning about it, I was like, how are we even compatible with the opposite sex? Because it's such a different brain. And just to allude to it a little bit more, the brain works in a way where the right hemisphere talks to the left hemisphere, as we discussed in the previous part of this episode. However, the hemispheres also communicate within themselves. So in the male brain, they found that the communication within just the right side or just the left side was very strong. So we call it intra-hemisphere communication. That's why when a man is thinking about nothing, he is legitimately thinking about nothing.
Oh my gosh, you've just given a whole sex an excuse for not paying attention.
I'm so sorry.
That's not the road I wanted to go down.
But it's the truth. That's why men, for example, they can go fishing and sit with each other on that boat for hours and not talk. Because literally there's a part of their brain that can just do that. Meanwhile, women, we can't shut up sometimes. Like we're so verbal and we're so expressive. And that's because the communication within our brain is very hemispheric. So the right and the left side are constantly talking to each other. Imagine like a ball of yarn just all knotted up and tangled. That's the woman brain. That's why we can never think of nothing, because we don't understand how to do that with all of that noise going on. But it's really important. And one of the things that I ask my male and my female patients when we're doing an initial exam is, do you guys go on date night? which they all are so confused by that question because like, well, I'm coming to see a chiropractor or a functional health practitioner. What does date night have to do with it? But it actually has a lot to do with it because to be so traditional, the man is supposed to court the woman and it doesn't stop at marriage. It really has to keep going throughout the duration of the relationship because the man is the provider and biologically and evolutionarily, we were designed that way. But when the woman is starting to take on a lot more demands in the relationship and is starting to be more manly, that's when we go into what we call a left brain escape. And that's when the left brain starts to turn up its volume so much and we start to notice dis-ease. And when I see a female client in my practice and they're on a lot of antidepressant medications or they're developing multiple sclerosis, this is one of the first questions that I ask because I'm like, how are you getting supported at home? How are you getting taken away from your role as mom, provider, nurturer, everything, and just being recognized for who you are? And a lot of the times it's not happening. So the differences between the male and the female brain are incredible, even the types of diseases that we see. For men, we'll notice that there's more movement type of disorders and more of a Tourette type of disease. And so you'll see a lot of times older men will have a walker or a cane. They'll have Parkinson's or dyskinesis, which is abnormal movement patterns. And women will actually have more personality type disorders where they will have more dementia, more Alzheimer's, more bipolar or multiple personality, because that's the way their left brain expresses in a state of dis-ease.
Okay, so getting back to a second or 2 seconds ago, I can't get past this point. Is the healthier male the one that can sit and do nothing for hours on end?
Yes,
exactly.
Oh, dear
God.
Okay. You want a man that when he tells you I'm not thinking of anything and nothing's going on in his brain, you want that.
Because my husband will live forever.
I'm telling you, even my husband, honestly, like when we're sitting on the couch, I'm like, what are you thinking of? And he's like, nothing. I'm like, no, come on. Like there has to be something. He's like, no, honestly, like there's nothing happening. And I believe him. Meanwhile, he asks me, does your brain ever turn off? It doesn't. Like I'm always thinking of something. And when we start to see a woman not be verbal and her brain is starting to turn off, it is becoming more male, you can say, but that really is a very layman's term of saying it's becoming more turned up in volume on the left hemisphere, which is what we don't want. When a man can't turn off his brain, again, same thing. His left hemisphere is going too high in volume and we want to turn it down.
This is opening up a whole door for a whole new show. I tell you, for a whole show on this. Okay, so this seems like a very deep area for a chiropractor to get involved in. Are you actually, like, how long is your intake?
My intake is half an hour because I send an intake form to them where we ask all of these questions. But depending on how thorough they are, I would go a little bit over half an hour or I'll get more info from them. And then again, I always encourage the spouse to come in at the second appointment because I want them both to understand how they can support each other, but also how they can heal through that support. Because when you're going to go home and tell your husband or your wife, yeah, my chiropractor told me that we need to go on date night. I don't know about you, but I'd be like, who are you going to see? Like, who is this person?
Well, are you dropping these little nuggets as you're doing adjustments? Like, when did these come up?
But honestly, I really encourage for the spouse or the partner to come in so that way they can understand how each other can be supported. And a lot of the times their jaws dropping or they're just as excited to hear about this information as you are and many others because it's so new. We don't talk about this at all.
I'm also interested. Can you tell me some of the functional blood work that you're doing?
Yeah, absolutely. So when it comes to my functional protocol, we start at foundations because this really helps to balance the brain. So we look at genetics, we look at organic acids testing, but we also look at blood work. Now, as a functional health practitioner and chiropractor, I can't send my patients for that. So I work through a naturopath that helps me with getting the required blood work. But we are looking at a complete panel. So we're not just looking, for example, at thyroid and looking at TSH, which is thyroid stimulating hormone, or free T3 or free T4. We're looking at the antibodies, the antiglobulins, as well as another marker called reverse T3. And this one actually does not get put on that requisition as often as we would expect it, unless you're going to see an endocrinologist. But this is a really important marker to look at because T3 is the active hormone to turn the metabolism on. But if we have too much stress or too much trauma, the body will reverse the T3 and make it inactive. So it will still bind to the metabolism, but nothing will turn on. Meanwhile, it's just taking up a space for the body to function and nothing's happening. And that's why a lot of people, they have hypothyroidism or they're on Synthroid or they're on natural desiccated hormones and they shouldn't be, but I'm not going to make that claim for multiple people, but we just need to look deeper into the blood work. So that's an example of one of the blood panels that I sent for. Another one would be homocysteine. So this is actually an amino acid, which is a building block of protein. But when in excess in our body, we actually can trigger a certain DNA pathway, which produces a lot of neurotoxic ammonia. And we don't even know that's happening. And that's actually happening within myself. I put the two together when I was doing my own protocol. And too much homocysteine can also lead us to cardiovascular disease or coronary artery disease, which are the arteries within the heart, or even things like stroke. So you want to really look at these markers for preventative reasons, not just when something happens.
So when you've got your panel in front of you, does the actual chiropractic work impact the blood work, or are you just, this is another phase of healing, and in this blood panel work where you see anomalies or inconsistencies, then you want to be doing the supplement part of it?
Yeah, I wouldn't say that the chiropractic work does get influenced heavily by the biochemical work that I do. Although I do keep it in mind, because if someone who has high homocysteine levels is more predisposed to have a stroke, I am just a bit more cautious in how I'm treating them on the table. However, when it comes to the functional health work that I do, this is done more as a regular practitioner type setting where it's more of a sit-down conversation each time. And we are working more in depth with supplements and more in depth with nutrition. So that way we can really clear up those biochemical deficiencies and restore the body to its natural optimal state.
And are you developing these protocols yourself, or do you have a team with you?
I develop everything by myself at the moment. One day, hopefully I'll have a team behind me, but everything is done with me and my brain.
And so people come in, they make a decision if they want to do the functional piece of it, or is this all part of the process?
No, it's a decision. So it's something that's separate and not for anything. It can get a little bit costly, especially here in Ontario, because we are very groomed to have everything paid for through OHIP. So I've had a lot of patients reject this protocol because it was just too expensive or insurance wouldn't cover it, it's truly unfortunate, but I also do understand that financially things are a little bit tougher right now. But this is something that would be separate just because we do need to dive into some functional health exams that would not be covered under OHIP or with your regular traditional medical doctor.
No, I know that firsthand. And they're clamping down more and more on the functional testing and who can do it, which is very unfortunate. And it leads many people to go south of the border to get some testing done and all of that. But that's, again, it's not part of what we need to be talking about here.
No, that's the truth.
Can you go over some key supplements? We're talking about healing the neural system. Can you give us examples of your mainstay supplements that you might recommend for brain health and neural health?
Yeah, absolutely. So I do have 5 basic nutrients or supplements that I recommend for individuals to take. But really, when it comes to supplementation, this is where the genetics of my program is very, very important because, for example, B12, this is one of my core 5, you can call it. However, someone like me who has a mutation in my genetics, I can't handle a certain type of B12, which is called methylcobalamin. Now, there's 4 types of B12, methylcobalamin being one of the most potent, most active, and also the most available in health food stores. But someone like myself, I can't handle it. And it's just going to trigger the production of more ammonia, which is neurotoxic in my body. So that's why the genetics plays an important role. So what I usually recommend for people to take is a hydroxycobalamin or a hydroxy B12, because this one won't disturb those pathways if they are active in the body, but you are still getting that neurological support through B12 in keeping the fatty layer around the nerve cell healthy so it doesn't start to deteriorate as we age. So B12 is one of them. Vitamin D is a huge one. It's actually not a vitamin, it's a hormone because it enters into the cell nucleus and it helps with DNA replication as well as specification. So a cell that is supposed to be a skin cell knows that, and it doesn't become a stomach cell, and then it starts to mutate and cause cancer. Another supplement that I usually recommend is zinc, but a zinc picolinate. We don't want to take zinc with copper because a lot of people can have copper toxicity and they don't even know it. So I usually recommend a zinc picolinate. Another one is magnesium. Magnesium is huge when it comes to producing energy, neurological brain function, GI health, but there's so many different versions of it out in the market. So magnesium citrate is one that is just for the bowels. It's just for the digestive system, which I would recommend if you are dealing with any issues there. But usually the two that I recommend would be a magnesium bisglycinate, if you can handle that glycine within there, or a magnesium malate. That's the one that I take because I can't handle the glycine. And then finally, the last one is P5P. This is an active form of vitamin B6, and this is involved in every single biochemical production, especially one that helps produce dopamine, which is a neurotransmitter, which is a chemical of the brain. We need dopamine in order to have these messages going through our body, and P5P is usually lacking. And once we start to introduce P5P, we start to see a really nice rebalance of things, especially people that have migraines, for example. Really helps a lot with that.
Interesting. Unfortunately, we're getting to the end of the show. I'm really enjoying our conversation here. Where are you located?
Yeah, my chiropractic practice is in Etobicoke at 555 Burnhamthorpe Road. And then my functional health practice is virtual. So I see people all over the world for that. And it would be over Zoom or over an online platform.
And how long have you been doing this?
Well, chiropractic is approaching 4 years and functional health is approaching about 6 months. But I've been involved since the age of 13 in nutrition and learning everything through the research. So it's been a while.
And where do you see your practice going? Do you have visions of where you'd like to be in the next few years, or new modalities that you'd like to bring into your practice?
Absolutely. So I am very much in tune with the spiritual side of healing as well. I'm very, very much an advocate for making sure that we have that emotional health, that spiritual health nurtured in such a secular society that we live in. So I see my practice going more in that direction. I would love to learn the technique called network chiropractic, because it is more of a light touch, but very impactful way to release trauma from the nervous system. And then just really helping people globally with all of their biochemical ailments, not waiting until it's too late and we're feeling like we're on a time crunch to get healthy. I just want everyone to know your body wants to be healthy. Your body does not want to stay in a state of dis-ease, but you have to give it the right tools. And sometimes that requires more guidance from someone who's more understanding about the body and how it functions.
And people of any age can come and see you, right?
Yeah, my age demographic predominantly is between 20 plus, more of an adult range, but I do work with some kids. It's just not as common for me because it's not my expertise, but I definitely have some recommendations of where you can send your children. So I usually work with more the adult population.
Okay. Well, I want to thank you so much for joining us. Great information, great insight. And, the future of medicine is being led by people like you. So thank you for sharing everything you do. And I really appreciate you joining us on the Health Hub.
Oh, thank you so much for having me on the show.
Everybody, we will talk to you next week on the Health Hub.
You have been listening to The Health Hub, hosted by Kathy Biasi, here on Radio Maria Canada.